All right, so I'm going to be talking about diuretics and how they can be helpful in hypertension. Thiazide diuretics are generally going to be your first line for hypertension. They are useful because they generally have a weak potency, and so you don't want to overdo it, certainly by going to a loop diuretic. So a thiazide diuretic can be a good starting place. In fact, it tends to be the recommended starting place for a lot of patients who have hypertension. Thiazide diuretics, in addition to being useful in hypertension, can also be useful in CHF and nephrolithiasis. Now, it's important to note that thiazides, in order to work, the patient has to have normal renal function. So be sure that the kidneys are working properly in the patients who you prescribe thiazide diuretics for. It's also important to note that thiazides can increase your reabsorption of urea and causing increased levels of uric acid in the body, leading to things like gout. So be careful again with individuals who get gout. The mechanism of action for thiazides is that they basically block sodium reabsorption in the tubules, which causes water then to be excreted into the tubules, causing lower blood volume and a decreased blood pressure. So as I mentioned, thiazides can increase uric acid, so you certainly want to be cautious with thiazides in people with gout. You also certainly, again, want to be cautious in people who have renal insufficiency. In addition, you also perhaps don't want to use thiazides in individuals with diabetes because thiazides can lead to hyperglycemia. Some of the other side effects of thiazides include hypokalemia as well as hypomagnesemia, and hypercalcemia, hypertriglyceridemia, and hyperuricemia and hyperglycemia, as I mentioned previously. These are just some of the various drugs that fall into the thiazide class. Probably the two most common that you're going to encounter is going to be hydrochlorothiazide and chlorothiazide or chlorthalidone, probably being equally second in line. Other diuretics include carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors also tend to be a weak diuretic. They work via a similar mechanism as the other diuretics, blocking basically, again, sodium reabsorption, which prevents then water from being maintained in the body, so you're excreting water more. In addition, they also tend to have a mild vasodilatory effect. Your uses for carbonic anhydrase inhibitors are generally going to be glaucoma, urinary alkalinization if you need to do that. You can also use it in cases of metabolic alkalosis and, in fact, also with mountain sickness. Just as with the thiazide diuretics, you also want to be careful in using carbonic anhydrase inhibitors in patients who have renal insufficiency. Some of the side effects of carbonic anhydrase inhibitors include nausea or vomiting, some numbness or tingling in the extremities, diarrhea, as well as polyuria, kidney stones, and potential metabolic acidosis, which is one of the reasons why you can potentially use it in metabolic alkalosis. The drugs that fall under the category of carbonic anhydrase inhibitors are your acetazolamide, which can be taken both orally or given IM, and dorzolamide, which is used as an ophthalmic solution. Third class of diuretics are your loop diuretics. These tend to be your strongest diuretics. They tend to be absorbed very quickly by the body. Like the other diuretics, again, they inhibit sodium reabsorption, this time, though, in the ascending limb of the loop of Henle. And what this, again, does is, again, causes greater water excretion. There is some minor proximal tubule action, but, again, most of the effect here occurs in the loop of Henle. Uses for loop diuretics are typically things like CHF. That's probably where you're most likely going to see it used. But you can also see it used in hypercalcemia because loop diuretics can actually cause hypocalcemia, so they can offset that action. They can also be used in pulmonary edema. As with the previous diuretics, again, you want to be cautious with loop diuretics in patients with renal insufficiency. Similar to the thiazide diuretics that we mentioned previously, These loop diuretics can also increase flare-ups in gout. And as I mentioned, loop diuretics can cause hypocalcemia. In other words, you're excreting more calcium, which basically can increase your incidence of kidney stones. So be careful of patients who have chronic kidney stone issues. Other side effects of loop diuretics include hypovolemia, hypokalemia, hypomagnesemia, hyperuricemia, again related to the gout, metabolic alkalosis, as well as some hearing problems related to ototoxicity. Perhaps the most common loop diuretic that you're going to see is furosemide or Lasix, but there are other ones. Bumetanide or Bumex is another common one. Ethacrynic acid and torsemide also are typically used.
My pen pages.
Potassium sparing diuretics also can be useful. They tend to be more useful in cases like refractory edema, Little syndrome, or antiproteinuric agents. Two of your common potassium-sparing diuretics are going to be amiloride and triamterene, which basically work by inhibiting reabsorption of sodium and preventing excretion of potassium. Spironolactone is slightly different. It is another potassium-sparing diuretic which blocks the aldosterone receptor, which blocks the creation of your sodium-potassium pump, and this again leads to increased excretion of water, and finally, as mentioned previously, a decreased blood pressure. Potassium-sparing diuretics, again, just like your other diuretics, need to be used with caution in individuals with renal insufficiency. Two of the most common side effects of potassium-sparing diuretics include hyperkalemia and metabolic acidosis. In spironolactone in particular, you might get anti-adrenergic effects like gynecomastia. Osmotic diuretics are typically not going to be used for your typical hypertension patients. Really, these are IV-only diuretics that are used in the hospital for emergency situations like increased intracranial pressure, increased intraocular pressure. They tend to work on the proximal convoluted tubule and the loop of Henle. By increasing the solute concentration in the tubules, again, that leads more water to be retained within the tubules, therefore decreasing blood pressure. Like your other diuretics, again, always be cautious in individuals with kidney dysfunction, and be careful of dehydration as well as acute hypovolemia. The two most common drugs you're going to see that are osmotic diuretics are mannitol, which is IV, and isosorbide, which is taken more orally. Finally, there are some diuretics that are combinations. So some thiazides can combine with potassium-sparing diuretics, or thiazides, combined with loop diuretics. So these are just a few of those. It's good to be familiar with these names. All right, and I hope you enjoyed the presentation.